Moment, let's focus in on all the latest updates with respect to coronavirus, and at the center of all of the action is a lot of healthcare companies. We have the Managing Director and CEO of Thyrocare, Dr. A Velumani, now joining in to give us a sense as to what the impact of the outbreak has been and how things are progressing on their front with respect to COVID relief. Thank you so much, Mr. Velumani, for taking time out. Let's talk a little bit about India's trajectory, and that has been steep and steady over the past few days as compared to the rest of the globe, though the curve has been flatter. Just tell us a little bit about how things are shaping up with respect to, as of now, the healthcare that has been put in place by Thyrocare.
Good morning. Of course, there is a fair control of the number of infected and number of deaths, but last week has been little disappointing in terms of the slope of both. As far as healthcare is concerned, it is not disrupted as much as many other industries are, especially with the COVID testing around. All healthcare companies are much more seriously working day and night. Having said that, the biggest blow appears to be, a setback appears to be, the Supreme Court advising without adequate information from the government as to what to do. So all laboratories don't know whether to continue today or to stop it or to wait for information or guidance from the government. Unfortunately, when things were improving, of course it was rich who paid and used. That is also now a big question. So there are challenges in testing, and if you understand testing is essential to understand the course of the disease across the country, pockets where it is more impactful. So I think this is a setback, but I hope by the end of the day some more guidance will come from the government to do the test, to whom and who will pay for it.
Right, and I also understand that there's a big move now by the Supreme Court, the interim order telling the government to make the COVID testing by private labs free of charge, and that the disbursement of the test may be allowed later. As of now, the centre is yet to respond to this order in the next 2 weeks. But how are you reading into this development from the Supreme Court for the free COVID testing?
Very difficult for laboratories. They don't have size. They don't have cash reserves, and currently all vendors ask us to pay in advance, and the prices of raw material, all related to COVID, have higher premium. I don't think government, even laboratories, can wait till, pay advance a month in advance and then wait for quarters to get the funds. It won't be that easy. There should be some workable, practical solutions by the end of the day given. Otherwise, laboratories won't be able to do the test even if they wish to.
Okay, and fair enough. Mr. Velumani, just tell us as of now, what has been the kind of numbers and volumes that you have seen with respect to the overall testing? What still needs to be done in order to ensure that we try and have a uniform testing in India? And what has been the update with respect to the overall ventilators? And do you think that our systems are now gradually getting in place with a lot of healthcare centers cropping up through the country? And what more is it that you think that is the need of the hour?
I think 20 days of lockdown is a very prudent move to minimize the onset or the infection counts too early, too much, too big. Having said that, I am sure entire country's medical infrastructure is at least 25 times better than what it was 20 days back, because everybody is working on it. More PPEs, more ventilators, everything appears to be more quarantine facilities. So I am personally of that opinion government should unlock 10% every day and see if it is helping and if it is not bothering. If it is manageable, it will be bothering. If it is manageable, manage it instead of thinking that delaying is the solution. That is not going to help us.
Okay, that is your request right now. Grab the bull by the horns and sort of come to some concrete solution. But thank you so much for taking time out, Mr. Velumani, and we will be connecting with you through the course of this very crucial period.